reflect on the work that's been happening as part of the Changing Futures programme. We're going to cover some of the achievements, lessons learnt, and the legacy of the programme and some future opportunities as we see them to continue championing the work of supporting people who face multiple disadvantage. We'll mainly be talking about the work that's taken place over the last year because we do only have 30 minutes. But if you're left wanting more, then please do get in touch. You know where to find us. So I'm Kath Williams. I'm the Changing Futures programme lead here in Bristol, and you'll be hearing from Emmy Davies, Ash Ward, and hopefully Tony today. As we get to those sections, people can introduce themselves. So in terms of housekeeping, please put your questions in the chat and we can pick them up from there. Chris and Ethne are behind the scenes doing some helpful technicalities. We'll come to the questions at the end. We are going to record today's session so that we can share it for people who haven't been able to come along. So please do stay on mute. And I think that's probably all I need to say, really. So on to the next slide. Thanks. So a quick recap in terms of what Changing Futures has been about. So Changing Futures began in 2022 and we were fully operational in 2023. And we cost approximately, it's been around £1.2 million a year for the programme, but that's fluctuated over time, and this year has been less because funding was reduced. So Bristol was one of 15 Changing Futures areas nationally. The Bristol City Council Adult Social Care worked with partners to put quite an ambitious bid together in response to the National Lottery and Ministry of Housing, Communities and Local Government funding opportunity. So once we secured those funds, the City Council then commissioned Second Step to be the lead delivery partner and to work with all partners across the sector that multiple disadvantage touches upon. So we've had a broad range of work happening as part of the programme. We've been adapting and acting on opportunities to add value and really essentially support more collaborative practice across the system. We positioned ourselves very much as an extra resource for a very stretched system. And thankfully, our relationship with MHCLG and the lottery has really allowed us to reassess priorities and pivot as we've gone along. So that's been a really important, different aspect of the way this programme's worked. We've been working at 3 levels. So we've been working with individual clients, the important people, thankfully, services and partners across the system. So when I sort of stand back and reflect on all the things we've been involved with, it can look like quite a strange collection of pieces of work. But behind the scenes, we've been very much using the 5 priorities within the multiple disadvantage strategy to really guide and shape our work. And we will cover some of those aspects today, but this isn't an exhaustive overview, it's just a taster. So on to the next slide, please. So without dwelling too much on the challenges, it feels right to recognise the context that we're all working within. It can be quite depressing to recognise that these challenges here, they do cut across all of our different silos, but there is some kind of unity in that actually, in recognising that we are all experiencing these challenges and there is common interest in addressing them. We have found it to be quite slow going at times, and we really need to make sure that collectively we recognise the small steps that are being taken forwards, really seeing where we are collectively shifting the dial and supporting people to have a better life effectively. So we have made some good progress together in understanding these challenges. We've been able to pull people together to share perspectives and look at what collective action can be taken. I think one of the key learnings for me is that we've learned to stop talking about system change. I'm hoping it's not going to come up in any of our presentation today, but really like doing the doing as opposed to talking about system change, which can alienate people. And we're seeing there is real evidence of multiple disadvantage being better understood, and recognition of the fact that we all play a part in moving the agenda forwards. So on to the next slide. As I say, we've done a lot of peopling across the program, and that's the part I've particularly enjoyed, because thankfully there are some really brilliant, dedicated experts across the system. So it's been a pleasure to bring people together and work together. This last year of activity has been much more about supporting partners to take action themselves. And as a team, we found that we've really needed to go where the energy is, rather than where we would struggle to really make an inroad, because we were conscious it was the last year of the programme. Hopefully you'll hear from Tony that we have positioned the My Team Around Me exchange groups as a real vehicle for strengthening partnership work. We've also run a number of topic-based appreciative inquiries to get stuck into some cross-cutting issues that people are grappling with. Just an example, next week we have a session where we're working with SARI and partners to explore staff experiences of racism across the system. So as I've mentioned, the wider system context, the reality is that we've all had competing priorities, very stretched resources. This has meant that some partners have been less engaged than others, and that's totally understandable. But thankfully, we are going to be able to carry on to support the exchange groups, particularly for another year. So it's never too late for people to get involved, and the door is very much open. On to the next one. So as I've mentioned, there are 5 objectives within the multiple disadvantage strategy. One of our actual key achievements was putting this strategy in place, because it really helped set the stage, and it gave a very clear mandate that multiple disadvantage was an agenda that needed to be focused on. You might be most familiar with our work on My Team Around Me, which Emmy will cover in more detail, but we have included some examples and some highlights across all of those 5 areas. There are a lot of resources, reports available on our Changing Futures website. And also we've been able to, as being part of 15 other areas, we have been able to link up with other Changing Futures areas. So we've strengthened those connections nationally, and show what's possible elsewhere, and to sort of plant some of those seeds of possibility here in Bristol. So I'm going to pass you over to Emmy, who's going to talk through My Team Around Me.
Hi, sorry, I was muted. Hello, I'm Emmy Davies, and I'm Senior Operations for Changing Futures. I'm sure most of you know me. So just a really quick recap. For those of you that have been on the journey with us, you'll probably remember that our initial 3 years of the programme, we were working directly with people experiencing multiple disadvantage. Those people were sort of broken down and held within three cohorts: homelessness and mental health, women experiencing domestic abuse and or sexual violence, and young people from the global majority who were having some engagement with criminal justice system. Whilst we were doing this sort of relational outreach to build connections with those people, we were concurrently developing the My Team Around Me approach with our lived experience team and with partners, and integrating the learning from the direct work as we went along. We went on then to develop training, a whole load of resources. As Kath said, there's lots of resources on our website. And then the My Team Around Me exchange, which supports the problem solving of system blocks and barriers for the people using the My Team Around Me approach. So we consider that to all be part of the My Team Around Me sort of way of working. The approach is trauma-informed, it's relational and flexible, and it works around a set of principles rather than a linear or stepped process. That's a little bit different to what people are sometimes used to doing, and so we've then sort of gone on and developed in this last year some additional spaces to help people translate that into action. So in this last year, because we had a year's extension, as Kath said, we sort of pivoted to being a bit more of a sort of consultative offer rather than an additional resource or capacity within the system per se. And so we then worked with system colleagues to support existing good practice and to, like I said, to translate the My Team Around Me training and tools into practice. And we looked at where to prioritise our resource, and through further consultation with partners, we agreed 4 partnerships, and we've been working alongside or in partnership with the MASH, the Multi-Agency Adult Safeguarding Group, the MARAC, which is the group for women experiencing domestic abuse or sexual violence, Eastwood Park Women's Prison, and the Bristol Homelessness Pathways. We collaborated with the partners in each of these spaces to identify priority people to focus My Team Around Me support with. And then we worked alongside lead practitioners for those people, helping them set up My Teams and, you know, just kind of literally how to do My Team Around Me in action. And alongside this, we continue to deliver training. We created a community of practice and we developed and delivered some bespoke offers for a couple of partners along the way as well. We also identified opportunities to support with pathway-specific systemic challenges. So we've been working really closely with the MARAC steering group to redevelop their terms of reference. And we worked really closely with the MASH to embed lived experience into the multi-agency safeguarding hub. If we could go to the next slide, Chris. Thank you. And so just what we've put on here is some of the evaluation from the national team. So some of this data on this slide is a collective of learning across all of the 15 areas of changing futures. I think, you know, there's some really nice statistics there that when we work this way with people in much more relational approach, wrap around and responsive, we can see a significant difference in their outcomes. So some key snippets here, but there's also links to the national report in the presentation that we'll send out to you. I think it's really important to note that what we're trying to do really is support people to lessen the impact of crisis. So I wouldn't say we're seeing people radically recover. It would be really strange for us to suggest that when people are coming from such complicated and complex backgrounds. But what we are seeing is that we can flatten the curve somewhat and create space in between cycles of crises for people to reflect and learn how they can best support themselves going forward. So we're trying to build efficacy and confidence over time rather than a reliance on the system, which is often what a typical crisis response will do. This in turn creates positive feedback loop for staff. It reduces stress and burnout. It is important to note that, you know, the system conditions need to be there to support practitioners to work this way. And this is learning across all of the changing futures areas. So, you know, having those opportunities to work flexibly, be enabled to challenge when the system isn't working for people, and obviously to hold lower caseloads than we might usually expect to see in other services. And that's it from me on My Team Around Me. So I think I'm handing over to Ash.
Thank you, Emmy. Hi everyone, I'm Ash, Senior Strategy Manager at Changing Futures. Chris, could you go to the next slide and then we'll go backwards to this one, just to make things complicated. Thank you. So I'm going to talk a bit about our work around lived experience. The idea that we ensure lived experience is heard at all the levels is a key strand in the Bristol City Council multiple disadvantage strategy. And we wanted to think more about how we do this. Lived experience is coming through in all of the national strategies that are being published at the moment. And I won't read through all of these points here, but the idea that we need to think differently at all the different levels about how we integrate people's views who have lived experiences of the services that we're trying to commission is really important. And I'll just quote that the the last bullet point there from Policy Lab, which says that policy designed without lived experience risks being extractive, ineffective, and misaligned with real world systems. And there's this quote that keeps coming back to us, which is that people with lived experience are often the people who are closest to the solution, but furthest from resources and power. So, we wanted to think about how we address this in Bristol and think about a whole system approach towards lived experience. Could you go back a slide, please, Chris? Thanks. Yeah. So last year we wanted to kind of implement this kind of whole system approach to lived experience, and we've commissioned a new service, Bristol Community Voice, which is not about us saying that we at Changing Futures have the voice. It really is about amplifying the kind of the spread, the wide range of different co-production and lived experience endeavours that exist across the city, and we've been mapping. There's probably between 50 and 100 different lived experience forums, different groups within services, outside of services, in communities, and the wider voice of the city as a whole. And so Bristol Community Voice, we've been working very closely with NECG, the National Expert Citizens Group, and the Revolving Doors Agency, to think about how we can bring people's voices into all the different stages of the commissioning cycle, and into service design. So working with commissioners and working with senior leaders in services, and working with communities to really ensure that people feel that their voice, their views, their perspectives are well represented in the way that services are being designed and delivered. That photo there is taken from an event that we ran towards the end of last year. It was our first Bristol Community Voice event, and it brought people together from across the city who are involved in delivering innovative projects that have really been driven by people with lived experience, that have made a real difference. And there's some reports on our website that you can read. I won't get into that too much here, but there's some more detail on that on our website. And so, yeah, if we can skip forward 2 slides, Chris. Yeah, thank you. So these are some of the things that Bristol Community Voice have been involved in this year. So we've been working with homelessness and rough sleeping commissioners at Bristol City Council to ensure people's voices are built into their 3-year planning, supporting the commissioning cycle, both at the kind of design stage, but also at the evaluation of involved in evaluating services. We've got a peer group set up, which is a group of people with lived experience who meet monthly to help as part of our exchange program that is like thinking about system blocks, and how we can kind of shape the whole system. We've got some really good collaborations with NHS partners, including the patient and public involvement team at UHBW. We've got people involved in the No Wrong Door working group, which is a kind of system-wide working group thinking about the challenges between substance use services and mental health services and how we can kind of streamline those pathways for people using those services. We have been developing a trauma-informed performance framework for homelessness commissioners at Bristol City Council that will hopefully shape their conversations with providers delivering the Bristol City Council homelessness pathway, and that's been shaped by people with lived experience. And the Bristol Community Voice team have been running a community of practice that brings together people from across the city, so practitioners, and people with lived experience who are involved in delivering their own co-production efforts within services. And really it's to kind of strengthen that practice and learn from each other. And that's really taken off and is a really, I've been to a few of those and they really are a very popular and engaging offer for professionals working in the space. So I think that's it on lived experience, but all of, if people here are interested to get involved in some of the stuff that Bristol Community Voice are doing, then please do get in touch. The next part of this presentation is about collaborative practice. So a big part of our work is thinking about the whole system. Kath put up the slide at the start of the presentation that really showed the kind of depth of the partnership, all the different agencies that we work with across the city. And if you work in Bristol, Bristol is a really collaborative place. Everyone wants to work together. So our work is not about necessarily doing the collaborative practice, but it's just ensuring that we're creating forums that mean people can come together and work together on whole system issues. And some of those forums are listed there. So we've been hosting the Multiple Disadvantage Transformation Board at Bristol City Council, bringing together senior leads to think about the transformation of services. We've been running this idea of the MTEM exchange that I'll come to in a minute. And we've also got some learning collectives that bring together people in services to think through specific challenges. And Kath mentioned that we've got one coming up next week with SARI, Stand Against Racism and Inequality, thinking about how services can respond to racial hatred and abuse that staff face, global majority staff face in their work. Chris, could you go to the next slide, please? Thanks. So this is just about the exchange. I hope that people who have come to this call have been part of the exchange. And if you haven't been part of the exchange, please do get involved, get in touch and join in. So the exchange is a mechanism or a forum that we set up last year. It helps us think through issues that are not specific to any one part of the system, but might affect people at all parts of the system. So there are 4 groups that meet to think through challenges, and the groups meet and the sort of challenges that they think through are shared across each of the forums. So we've got the Multiple Disadvantage Transformation Board that's got kind of senior level executive leadership in. We've got our system stewards group who are commissioners, maybe people who are involved in leading services, practitioners group, which is mainly frontline workers, and the peer space, who are people with lived experience. And those 4 groups work together to solve system blocks. And we always try and keep the person at the center. So the kind of challenges that we're thinking about are where the system has become too complex and it's not serving people well. And I think that quote there kind of brings it to life. I won't read the quote out, but it's really about kind of helping people connect with each other, build relationships, and address shared challenges. And I think, Chris, if you go to the next slide. Last year we evaluated the exchange as part of our yearly evaluation. These were the kind of key points that we found. So problem solving, people said the problem solving was shared. Staff felt very empowered going to the group. Staff felt confident that they had a voice in shaping local systems, and much stronger cross-agency relationships. So people understanding how other people work and why they work in that way, which obviously reduces tension and kind of improves how people feel about their co-workers. And on the next slide, I won't read through all of these, but we are showing the slide pack, so do have a read through. These are some of the things that have come through the exchange over the last year. This is just the topics. The current topic is we're looking at how we can think much more about trauma, and in particular trauma stabilization. And we've looked at some models from around the UK. And in particular looking at some workforce development models, so thinking about how we could develop some sort of whole system workforce approach to giving practitioners in frontline services the skills to help the clients they work with regulate trauma presentations in the here and now. So that's the sort of topic that is discussed at the exchange. And yeah, I'll leave it there. But if you're interested in being part of that process, people are always welcome to join those forums, and we would encourage people to get involved. So that's that. Yes, okay. So another strand in the strategy is this idea of furthering the evidence base, that actually the evidence, our sort of local and national evidence around multiple disadvantage isn't that well defined. We all know that co-occurring conditions are a challenge for people, and it reflects that services are not well set up often to kind of respond to that. But there isn't a strong data, there isn't a strong evidence base, and we've been trying to contribute to that. So this page has links to 3 reports that we've been involved in developing over the last year. The first is our deep listening report. Deep listening interviewed clients in a kind of phased interview process, and it's quite a sobering, hard-hitting read. It talks about people's experiences of past trauma, how services can often be a source of trauma, and some of the challenges that clients have faced having their needs met. It's definitely worth reading. The other report we wanted to mention is our work with the ICB, the BNSSG ICB system-wide dataset team. So the system-wide dataset is a health record across BNSSG, and we wanted to understand what the scale and prevalence of multiple disadvantage looks like across MD. It is a very kind of health-focused report. There isn't that system-wide dataset doesn't pull in information from criminal justice services or, for example, domestic violence services, but it does give us a health-focused snapshot on MD, and there's a report that you can access on our website if you're interested to read more on that. And the last report that I just wanted to mention here is this report that was published this week, I believe, or possibly last week. It's just come out, Support for Families Through Care Proceedings, which looks at how the involvement of social services with families who are subject to care proceedings can sometimes be a source of harm. Obviously, lots of people, parents going through that process may experience multiple disadvantages or have co-occurring conditions. And child removal is an incredibly intensely traumatic experience and can actually worsen health outcomes. So this report looks at how social care teams can deliver a much more trauma-informed approach to care proceedings. And that's literally just been published. So these are three really interesting reports that I think we're all really proud to be have been part of, and I would definitely encourage people to have a look at our website and have a read of those. And I'll pass to Kath. Thank you.
Thanks, Ash. So just a couple of minutes for me to sort of wrap things up, really. So in terms of what the future does look like, people will be aware that we have had the disappointing news that Bristol is no longer going to be eligible as a Changing Futures area. The Changing Futures nationally is going to carry on, but it's linked to allocations are linked to indices of multiple deprivation. So Bristol doesn't qualify. However, we have got really firm commitment to carry on with this work locally. So it's not doom and gloom. There is a real firm commitment for us to keep going with the multiple disadvantage agenda. So the multiple disadvantage transformation board continues. And as we've mentioned, those layers of the exchange will continue to be there. I'm actually going back to my post in adult social care as a strategic commissioner next month. And I now have multiple disadvantage as part of my portfolio there with other people. And we will also be working with the policy team on refreshing the MD strategy. So it's definitely not going away. We have a small amount of underspent, as I've mentioned. So there are some elements of the programme that will continue for 12 months or 6 months for Bristol Community Voice to really secure some longer term sustainable funding. We are in the process of closing down our office here in West Street. So if anyone is in the market for some office furniture, please get in touch because we've got lots to give. And as Ash has sort of talked through, we've got a real wealth of valuable evidence now about sustaining the investment and focus on multiple disadvantage. Thankfully, there is now some really concrete cost effectiveness evidence that's come out from the national programme. So that's really, really helpful. And we can see the links and the connections to lots of local strategies. And I think the final slide is also just recognising how impactful the national programme has been in influencing national policy. So particularly multiple disadvantage is now included as a key outcome within the local government outcomes framework. So that's really fantastic to see. And it's recognised in a lot of national strategies. So, there really is focus on keeping going. So I will leave it on that positive point. Thank you all so much for being here and for listening and for being part of the journey with us. You know where we are if there are further questions. And yeah, great to continue working with you all. So thank you, everybody. I think we'll close the session. Thanks all.